Well, February is Heart Month. It's a great time for men and women to take a closer look at their heart health. Joining us here in studio is Dr. Maren Shetty and Tracy Monks with the American Heart Association right here in Kentucky. And Tracy, I know you're going to be with us quite a bit in February, so get used to seeing you here, because we want to bring awareness each and every week to what's happening with Heart Month. It kind of really, I feel like it kicks off, what, Friday?
Yes, it's Wear Red Day.
Yes,
Friday.
It's Wear Red Day. You're going to be seeing everybody wearing red. What do you hope that message, what does it say and what does it send?
Well, it's bringing awareness around women and heart disease, because we know that heart disease is the #1 killer of women and men, but especially women. It kind of gets overlooked at that point in time. So we really want to emphasize that, really take a look at women and understand your body and know heart disease is one of the killers.
We're going to zero in on that, Dr. Shetty. What do women need to know? How can you start taking stock of checking your heart healthy list, so to speak?
Absolutely. Women are not small men. So we have the same symptom, we have the same disease process, but we present very differently. So we may have chest pain, but we may also have nausea, shortness of breath. All of this starting up to 1 month before the actual heart attack.
Oh wow, 1 month.
Absolutely.
Can you think of it as, when people, sometimes you hear women say, oh, I just think it's indigestion?
Yes, all the time. And not only do the women blow it off, the doctors sometimes blow it off as well. So that's exactly what we're trying to change with the University of Louisville Women's Heart Clinic.
And what steps do you think women can take to start making sure that our heart is healthy? Because we may see some of those symptoms, go to the doctor, taken care of, but there's some things we can start doing right now.
Right, and it starts at home.
Yeah.
So #1, if you're smoking, stop smoking. It's just not worth it. #2, physical activity, just 30 minutes a day. It can, change how you feel. It's good for your mental health. #3, the way that you eat. So vegan diet is the best for heart health, but also if you can't, leave your meats, try the Mediterranean diet. There's a lot of recipes online that you can look at. Next is go see your doctor. Talk about the 3 B's, so that's BMI, blood pressure, blood cholesterol, and blood sugar. And the last thing is you want to ask them if you're eligible for a coronary calcium score, if you're between the ages of 40 to 70.
What does that do?
It's basically a screening for coronary artery disease.
Okay.
It's a low-dose CT scan, no contrast given. It's very quick. The body deposits plaque, and then it starts depositing calcium on top of that. So we can actually see calcium deposition way before you have symptoms. It's a powerful tool. If insurance doesn't cover it, it's $99 out of pocket.
Not bad, not
Absolutely.
bad at all. And I think
It's
a lot of
worth
times if you would bring that up to your doctor, they'd probably say, let me find a way to help pay for this for you.
Right.
And of course, one thing that we all can do, whether we have it in our family or not, is learn hands-only CPR.
Yeah, that's one of the most important things, and what we will be pushing out for the Heart Month is at least have one person in every household trained in CPR.
You never know when you're going to use it. I think sometimes people can be very intimidated by it, but you don't have to blow in somebody's mouth anymore. Not necessary. It's really the compressions and how quickly you're going.
Absolutely. So if you see somebody down, make sure they're lying on a sturdy surface. It's just 2 steps. First thing, either you or have somebody call 911. The second thing is you're going to come up to the patient, place the heel of your palm on top of the center of the patient's chest, place your other hand on top, and push hard and push fast. So what you're aiming to do is compress about 2 inches down, let the chest recoil back up to its natural position, and then just keep pushing hard. You want to hit about 100 to 120 beats a minute. You can think of the Bee Gees song, Staying Alive, so that's kind of the tempo that you want to go. Keep going until you see signs of life, so if they start breathing, if you tire out, or if EMS arrives, that's when you stop.
Right, and good thing you've already called 911, so they're on the way. You don't have to stop and make a phone call, make that phone call first, get somebody else to make it so you can start those compressions as well. I know last year you all were at a number of events, or you offered training. Are you all doing that again?
Yeah, we're going to be all over during Heart Month in all different places. And we're going to be partnering with some local organizations such as the fire department to start training some of those. So stay tuned for that.
When you all do the pop-ups and things, they're doing it like these big public events, you realize that in the middle of this event, it is possible to learn it. It is possible to get down and help somebody and save their life. You can really jump in and make a difference.
It takes 5 to 10 minutes to be able to learn hands-only CPR.
That's it.
That's easy.
Don't need a day of training. Here we go.
And it can double or triple your chance of survival.
All right. Well, once again, thank you all so much for stopping by. Heart Month, we're going to be seeing you guys a lot. We're going to be talking all about, especially what women can do to kind of look out for those warning signs. So for more information on Wear Red Day or the American Heart Association, visit heart.org.